Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer Buzz is here at the ACCC 50th Annual Meeting and Cancer Center Business Summit. We're here all this week as oncology leaders from across the nation collaborate on the latest issues and trends in cancer care. Speaking of issues, also this week, we had some members of ACCC over on Capitol Hill for ACCC's Hill Day. Dr. Sarah Hudson-DiSalle was at Hill Day speaking to congressional leaders here in D.C. She's the Assistant Director of Infusion Reimbursement at the James Cancer Center Hospital in Columbus, Ohio. Hi, Dr. Hudson-DiSalle.
Good afternoon. How are you?
I'm great, thank you. You have been busy.
Have been busy. Yesterday was really a full day on the Hill, and today and tomorrow are some great material that are being highlighted at the ACCC meeting here. So it has been hopping, yes.
Now, there are several issues that you brought to members of Congress and senators this week on behalf of the oncology community. One of those issues is patient navigation. What did you let those offices know, and then what was the feedback from them?
Yes. So I think first and foremost with patient navigation, wanted to thank members of Congress for supporting the expansion of patient navigation into becoming a reimbursable benefit for Medicare beneficiaries, and how that's so important to the cancer patient as they make their journey from, diagnosis to treatment to remission and beyond. And, asking that in the future that they remain open to additional needs that may be down the road as this area expands and as more patients, have to make that cancer journey. And then also that ACCC is a great source of reference, and having, especially with its membership of its size of over 40,000, approaching that 50,000 membership base, is a great resource for members of Congress and the Senate.
Fantastic. Another issue that you were talking about on Capitol Hill is financial toxicity. We're so concerned about this with our patients. What did you talk about in terms of policy?
Financial toxicity actually was a very hot topic that the staff on the Hill really wanted more information about this, of having that formal definition of financial toxicity and how that impacts their constituents, and then how that impacts legislation. We actually had requests for our financial advocacy guidelines from FAN, which is a wonderful resource for our institutions in dealing with our patients and as they traverse, that cancer pathway, but also for members of Congress in that what should be the gold standard as patients use, they traverse prior authorization, as they traverse, financial literacy, as they traverse step therapy. And, one of the pieces that we did think was around, first example would be the passage of the Improving Seniors Timely Access to Care Act last year, and how that impacts, and that they to be open and, have that dialogue for future legislation that's going to come through. So I think this is really an area that are impacting many constituents across the United States and in Ohio, because that's where I'm from. But I was really, really bolstered by the interest as well as, the request around the Financial Advocacy Network guidelines.
You told me before we started this interview that you also talked about drug shortages. What were you hearing about that?
I think most of the folks that we talked with were very familiar with drug shortages that are there. The responses that we received back, ACCC is a part of a coalition that is partnering with other agencies such as HOPA to provide some guidance around good policies and or legislation. The feedback after, we've talked about how that impacts, our cancer centers, our cancer patients, as well as the highest level of drug shortages that we've ever seen. All of those offices are very open to passing some type of, common sense legislation that helps to ensure that, we kind of help to eradicate that systemic drug shortage and supply chain issues that we're seeing.
We can tell you're very passionate, and we are so grateful that you were up there on behalf of the oncology community. Dr. Hudson-DiSalle, thank you so much for this download.
Yes, not a problem.
We'll have more information on ACCC's Hill Day and these issues in the show notes. Thank you for following along this week from the ACCC 50th Annual Meeting and Cancer Center Business Summit. I'm Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.